Right now, in 2026, measles cases in the United States have climbed past 1,700, the highest number in decades, almost entirely among unvaccinated children, while at the exact same time, federal health messaging has been quietly rewritten in ways that made people trust vaccines less. That is not speculation. That is a finding from actual research measuring how people responded to the changes. Meanwhile, a supplement bottle sitting in your bathroom cabinet right now was never required to prove it does what the label claims, before it ever reached the shelf. By the end of this video you will understand exactly what the science actually says about both of these things, separated cleanly from the noise, the politics, and the panic. Quick ask. If this kind of careful, evidence-based breakdown matters to you, hit like, subscribe, and tell me in the comments what health claim you have seen recently that you genuinely were not sure how to evaluate. It genuinely shapes what I dig into next. Let's get into it carefully. The myth that refuses to die. Let's start with the claim that has caused more real-world harm than almost any other piece of health misinformation in modern history, the idea that vaccines cause autism. Here is the honest origin story because it matters. This claim traces back to a single 1998 study involving just 12 children, published in a major medical journal. That study was later retracted entirely, after investigations found serious ethical violations and manipulated data, and the lead author lost his medical license as a direct result. Since then, decades of large-scale research involving millions of children across multiple countries have consistently found no connection between vaccines and autism. The American Medical Association states this plainly: an abundance of evidence from decades of scientific studies shows no link between vaccines and autism. This is not a contested scientific question sitting on a knife edge. It is about as settled as science gets. Here is where the story becomes genuinely strange, and where 2026 adds a new, uncomfortable chapter. Despite that settled science, changes were made to CDC website messaging that implied a possible vaccine autism link, despite the underlying research not supporting that framing. Researchers studying the effect of this specific messaging change found something worth sitting with directly. It made people view vaccines as less safe, reduced their willingness to get vaccinated, and weakened trust in public health authorities overall. Picture the mechanism at work there. It is not that new data emerged and changed anyone's mind. It is that the framing of existing, unchanged information shifted, and that framing alone was enough to move real behavior. This matters because it illustrates something crucial about misinformation in general. Sometimes it is not a fabricated study circulating on social media. Sometimes it is simply a subtle shift in how already existing accurate information gets presented, without changing a single underlying fact. What is actually happening with vaccine policy in 2026? Now let's talk honestly about the broader policy landscape, because separating the science from the politics here requires real care, and I want to walk you through what actually happened rather than what any particular side claims happened. For decades, changes to the U.S. childhood immunization schedule followed a specific, deliberative process, run through a federal advisory body called ACIP, the Advisory Committee on Immunization Practices, involving in-depth review of safety data, effectiveness data, and public discussion, with results historically endorsed jointly by the CDC and major medical organizations like the American Academy of Pediatrics. In 2026, that process visibly changed. All 17 sitting members of ACIP were replaced, and in January the CDC's acting director approved a new childhood immunization schedule developed by federal officials without following that traditional ACIP review process, removing some previously universal vaccine recommendations. Major medical organizations, including the American Academy of Pediatrics and the American College of Physicians, responded by publishing and endorsing their own separate schedule, explicitly stating they wanted a schedule that remained, in their words, thoroughly researched and rooted in science. And several groups have pursued legal action specifically requesting transparency about the evidence behind the changes. Here is the honest, careful distinction worth holding onto through all of this. Disagreements about the process, who gets to set health policy, how much transparency that process deserves, are legitimate questions people can reasonably see differently, and I am not going to tell you what to think about that particular fight. What is not a matter of reasonable disagreement is the underlying biological question of whether vaccines cause autism. That question has an answer, established through decades of independent, replicated research, and it has not changed because a website's wording changed. Meanwhile, the real-world consequence of declining vaccination confidence is not abstract. CDC data shows measles cases climbing to over 1,700 in 2026, concentrated overwhelmingly among unvaccinated children, with health officials directly linking the resurgence to falling vaccination rates. This is general health information, not personalized medical advice, and any specific vaccination decisions for yourself or your family are genuinely worth discussing directly with your own doctor, using the actual clinical evidence rather than headlines from any single source. The supplement aisle, a completely different kind of gap. Now let's pivot to a topic that gets far less scrutiny than vaccines, despite arguably deserving just as much: the supplement industry sitting quietly in your pharmacy and grocery store. Here is a fact that genuinely surprises most people the first time they hear it clearly. Under a 1994 law called DSHA, the Dietary Supplement Health and Education Act, the FDA does not have the authority to approve dietary supplements before they hit the market. Read that again slowly. Unlike a prescription drug, which must prove both safety and effectiveness through extensive clinical trials before reaching a pharmacy shelf, a supplement manufacturer generally does not need to submit evidence to the FDA proving their product works, or in many cases even that it is safe, before selling it to you. Picture what that actually means walking through a supplement aisle. Two bottles can sit side by side, one containing a well-researched, properly dosed ingredient, the other containing a proprietary blend with unclear amounts of unproven ingredients, and from the outside, both look equally credible, equally regulated, equally trustworthy. They are not. The market has grown from roughly 4,000 products in 1994 to an estimated 100,000 products today, and the FDA still lacks something as basic as a required registry to even fully understand what is being sold. Here is the myth worth killing directly. A supplement bottle displaying a disclaimer like this statement has not been evaluated by the Food and Drug Administration is not a minor legal footnote you can skim past. It is, quite literally, the company telling you upfront that no government agency verified the specific health claims on that label. That disclaimer exists precisely because DSHA does not require pre-market proof of efficacy. This is not a claim that all supplements are useless or dangerous. Many have genuine research behind them, but it does mean the burden of checking that research sits largely on you, the consumer, rather than on any regulatory body verifying it in advance. How to actually evaluate a health claim yourself. So how do you tell the difference between real evidence and confident-sounding marketing, whether it involves a vaccine claim or a supplement bottle? Here is the practical framework researchers and clinicians consistently point back to. Ask whether a claim has been tested in actual controlled human trials, not just animal studies or a single testimonial. Ask whether the finding has been independently replicated by different research teams, since a single study, however striking, is a starting point for more research, not a final verdict. Notice the difference between a randomized controlled trial, where people are randomly assigned to different conditions specifically to isolate cause and effect, and an observational study, which can only show that two things are correlated, not that one definitely caused the other. And be specifically alert to language shifts, not just outright fabricated claims, since as we saw earlier with vaccine messaging, sometimes misinformation works by subtly reframing accurate information rather than inventing something entirely false. This same framework applies whether you are evaluating a headline about vaccine safety or a supplement promising dramatic energy, weight loss, or hormone optimization. The question is never simply, does this sound plausible? The question is, what kind of evidence actually supports this, who conducted it, and has it held up under independent scrutiny? Bringing it all together. So here is where all of this actually lands once the noise gets cleared away. The vaccine autism link is not an open scientific question. It was investigated thoroughly decades ago, and consistently disproven across enormous, independent bodies of research since. What is genuinely happening in 2026 is a policy and process dispute, layered messaging changes that measurably shifted public trust even without new underlying data, and a real-world resurgence of a preventable disease tracking closely alongside falling vaccination confidence. Separately, the supplement industry operates under a regulatory structure that puts far more responsibility on you as a consumer to verify claims than most people realize, precisely because pre-market proof of effectiveness was never legally required in the first place. The honest thread connecting both halves of this video is the same. Confident-sounding claims, whether stamped with a government website or printed boldly across a supplement label, are not automatically backed by the rigorous evidence that confidence implies. Genuine scientific literacy is not about blind trust in any single authority, and it is not about reflexive suspicion of every institution either. It is about learning to ask the right question, every single time: what does the actual evidence show, and has it survived being checked? If this helped you feel more equipped to sort real evidence from noise, subscribe, because we are going to keep pulling apart the health claims everyone repeats but almost nobody actually explains properly. I will see you in the next one.